Welcome to my channel, BodyTalk. Diagnosis. Making a diagnosis, since the symptoms of COPD can mimic those of other lung illnesses, it can frequently be challenging to diagnose. Many COPD patients might not receive a diagnosis until the illness has progressed. In addition to reviewing your symptoms, your healthcare provider will inquire about your medical history, family history, and any exposure to lung irritants, particularly cigarette smoke, in order to diagnose your illness. As part of a physical examination, your doctor will listen to your lungs. No one tests a pulmonary function to determine how effectively your lungs are functioning. Pulmonary function tests are performed. These examinations could consist of spirometry. You exhale rapidly and strongly through a tube that is attached to a machine during this test. Spirometry determines the amount of restricted airflow and diagnoses COPD. Test of lung volume. The volume of air the lungs can hold at various points during inhalation and exhalation is measured by this test. Diffusion test of the lungness. Test demonstrates how effectively the body transfers carbon dioxide and oxygen from the blood to the lungs. Laboratory tests analysis of arterial blood gas, the effectiveness of your lungs in eliminating carbon dioxide from your blood, and supplying oxygen to it is gauged by this blood test. AAT deficiency testing, alpha-1 antitrypsin deficiency, is a hereditary disease that can be detected by blood tests. Treatment, the severity of your symptoms, and whether you frequently experience episodes when they worsen will determine how you are treated. We refer to these episodes as exacerbations. Effective treatment can reduce the risk of complications, manage symptoms, moderate the rate at which the illness develops, and enhance your capacity to lead an active life. No one. Quitting smoking. Giving up smoking. Giving up smoking is the most important part of any COPD treatment program. Quitting smoking can prevent worsening of COPD and respiratory difficulties. However, it's difficult to stop smoking, particularly if you've tried and failed. No. 2. Medicines. The symptoms and problems of COPD are treated with a variety of medications. Some medications may be taken regularly, while others may be taken only as necessary. The majority of COPD medications are administered by inhaler. When you inhale the fine mist or powder, this little handheld gadget delivers the medication directly to your lungs. To find out how to use the recommended inhaler correctly, speak with your healthcare provider. Therapies in-home, non-invasive ventilation therapy, oxygen therapy, and a pulmonary rehabilitation program can all aid in the treatment of COPD. Oxygen therapy. You could require additional oxygen if your blood oxygen level is low. Either a mask or plastic tubing with nose-fitting tips can be used to provide this additional oxygen to your lungs. An oxygen tank is connected to these. You can increase your mobility using lightweight, portable devices that you can carry with you. Surgery. Some patients with severe emphysema who don't respond well to medication alone may benefit from surgery. Among the surgical options are surgery to reduce lung volume. Small wedges of diseased lung tissue are removed from the upper lungs by the surgeon during this procedure. This makes more room in the chest, which allows the diaphragm, a muscle that aids in breathing, to function better, and the healthy lung tissue that is still there to expand. Lung replacement. If certain individuals meet certain requirements, they may be eligible for a lung transplant. A more active lifestyle and easier breathing are two benefits of lung replacement. However, there are serious dangers associated with this big procedure, including organ rejection. If you like this video, subscribe my channel for more interesting videos like this.